Welcome back to the Nursing Ministry channel, a platform where we discuss nursing as a profession and as a ministry. For those returning, thank you very much. And for the first timers, I welcome you. My name is Ludia Osita, a registered nurse. This platform has been set up to help you understand the nurse that is within you and how to bring out that nursing within you to serve your families and as your community. For the returners, you do understand where we are at this point in our discussion. And for the first timers, I'd encourage you to go back and watch our previous videos, because the latter video is a build-up from the former videos and will help you understand where we're coming from and where we're going to, and it will make the discussion much more enjoyable and informative to you. So in our previous videos, we had mentioned how God, as our creator, created building up from one level to another. Each day, he created something that built up to the following day until he finished his creation. And that is what nursing is all about. It is a hierarchy where we have our basic nurses as the certified nurse assistants, followed by the licensed practical nurses, then the registered nurses, then the charge nurses, followed by the advanced practice registered nurses, then the directors of nursing, and finally the chief nursing officers. Now, we are pursuing a new episode today, a new topic, and this topic today is based on the prerequisites into the nursing curriculum. What are the basic prerequisites that are required before entering into a nursing program? So this is an episode that is going to discuss, if at all one is interested in studying nursing and learning what nursing is all about before pursuing it as a career. So we're going to get to explore what are these prerequisite courses that one has to do before being qualified to get into a nursing program in an educational institution, whether it is a polytechnic or a college or a university. There are core courses that one has to qualify in before being accepted. Now, a disclaimer, these courses vary from one country to another, although not so much far off, and that is why I have termed them as the basic, because despite the nation that you may go to, you may find particulars of these courses. So you may miss one ingredient or the other, but most likely these are the requirements that one has to be able to qualify in before they are accepted into the nursing program to pursue the nursing degree or diploma or any certification that will qualify one into becoming a nurse. So I'm going to focus more on the registered nurse qualification, because remember, we mentioned that the registered nurse is the total nurse, the main nurse. So whatever I'm going to discuss, I'm going to base it mostly on the registered nurse, because the certified nurse assistant has their own curriculum, and the licensed practical nurse is not so much far off from the registered nurse. But then again, I don't want to delve into that because we discussed them in our last episode. So let's dig in. I'm going to start off with a scripture for the day. And by this, I have picked up this scripture from Jeremiah chapter 12 and zooming in on verse 5. Now, in Jeremiah chapter 12, verse 5, Jeremiah had complained about the situation that he was in, how troubled he was, how the environment was so unfavorable to him, and what he was going through. And then the Lord answered him and told him, Jeremiah, if you have raced with men on foot and you are worn out, will you really be able to succeed if you have to race with horses? And if you have stumbled in a plain field, in an open field, how will you manage the thickets by the Jordan? Let me make you understand. In a race, if you have one racer next to another, you're all men, you're all human beings, and you are racing, Your stamina and your strength will determine who will be the winner in this race. If at all you'll finish the race, because sometimes you get tired and you can't race to the finish line. And so the Lord is telling Jeremiah, if just by racing with human beings, what if you have to race with a horse? You know how strong horses are. You know how swift horses are. So he's being told, if you cannot race with human beings because you get tired, what if now you have to race with a horse which is stronger, has more stamina? Will you not be defeated? Will you not faint even faster? Now, you know that apart from supernatural help, it's almost impossible to defeat or even to outdo a horse in a race. There's one man who did it, and that was Elisha, when he outran the chariot of Ahab. But in this case, the Lord is trying to tell him, if just by running with your fellow men, you are complaining, you're getting out of breath, you can't do this, then what about what is coming, which may be even more intense? That means you will faint, you will not be able to make it. And so he used the same analogy when he said, you can't race in an open field. An open field is where there's nothing to cause you to stumble. It's just maybe a field of grass lawn, and you cannot run without falling. If you are falling all the time, and yet there's nothing to cause you to stumble, what happens when you go to the forest, the thickets by the Jordan, where trees have fallen, there are shrubs, there are rocks, you can't even see where you're going, yet you have to run there? How is it going to be? Doesn't it mean that it is going to be impossible for you? So in other words, he's trying to encourage Jeremiah to keep going, to be strong enough, because it can even get more intense and he may not be able to survive what is ahead. So by relating it to nursing, because nursing is a ministry and there's a nurse in each and every one of us, these basic prerequisites or courses or classes that one has to take are the courses that will determine, or the educational institution will determine, is this person ready to go through the intense courses that are in the nursing program? So if you can pass these basic prerequisites, it tells the institution that is supposed to take you in as a candidate that yes, you'll be able to withstand the hours. Some courses are hours long, 4 hours long, 5 hours long. So if you can pass these courses that are maybe 30 minutes, 1 hour long, then yes, you can qualify to get into these institutions and sit through 5-hour courses, sit through a whole shift of 12 hours, sit through the intense information that you're going to get in the courses that are coming. That is the analogy that I can present to you. So what are these requirements? So I'll break them up in two categories. There are requirements that you have to present for the institution to look through before allowing you to take some courses that will now qualify you to enter into the nursing program. Now, please understand that some institutions can merge these requirements or separate them. What I mean is, they may allow you, for instance, no, let me go through the courses, let me go through the outline, then you will understand this better. So we have, number one of the requirements that an institution may want, again, depending on the nation, depending on the jurisdiction. So depending on the institution or even the country or what the requirements is for that area that you are in. Number one, you may have to pass your high school, you may have to get a high school diploma. By that I mean, there are some examinations that one does, you've done your years of high school, you've qualified and you have your grades. So some institutions will refer to those grades. So some may say that the cutoff is one has to get probably a B, an A and a B only. Anything below that, they are not qualified to join the nursing program. Some may take a C plus as a cutoff mark. Others may not even be bothered about the high school qualification and may use another criteria which you're going to discuss. So high school may be one of the first requirement to join this nursing program. So one has to go through their primary education and then qualify through high school. Once you get your certificate, you present it to the education institution. If you have made the cutoff mark, then you're qualified and shortlisted to join the nursing program. That may be one. The second one may be an entrance examination. So it may be that they're not looking at the high school qualification. You have to take this exam that they have compiled, maybe an hour-long exam or 2 hours long exam. It may have a little bit of 1 or 2 or 3 basic tests. Then they compile the exam, sit for it. Once you pass that exam, maybe they may say that the cutoff mark is 80%. If this candidate sits for our test that we have set up or entrance examination, if they get anything 80% and above, we consider them to join the nursing program. Some may use the cutoff mark as 75%, some 60%, depending on how they have set the exam and what their requirement is. So our third requirement may be an essay. So the candidate may be required to write an essay. So probably they are told using 1,000 words, using 2,000 words, tell us why you want to join the nursing program in our institution. Or tell us why nursing as a career is, why nursing is your career of choice. So you are able to express yourself and say why you want to join nursing, to be a nurse. You'll say probably one candidate may state, my grandmother was a nurse, my mother was also a nurse, my sisters are nurses, so I've decided to become a nurse. While another candidate may speak of nursing as a passion and state that they've always wanted to be a nurse. They feel that their passion is to help others, to see them recover, to restore them back physically, mentally, and socially. So when it comes to shortlisting, it is clear to see that this candidate, whose nursing is a passion, may be shortlisted into the program instead of the candidate who stated that their entire lineage are made of nurses, because they see that this one whose it is a passion may force themselves through and may have the stamina to go through the 3 years, 2 years, 4 years of nursing program. Vis-a-vis the other one who saw the lineage of nurses, they may reach somewhere in the middle of the program and then surrender and not finish the entire program. So that is what they may use to see what is in your mind concerning the program before they shortlist you. That way they're able to have candidates who are more serious and may scale through to the end and not lose candidates on the way and deny the chance for others who may even have gotten in and done better to the very end. So now we have the high school diploma as one of the criteria used. Then we have spoken about the entrance examination. And finally, we have mentioned the essays that one is required to write. Then the fourth criteria may be an interview. So maybe they're not looking at the nursing qualification. They're not considering your entrance exam. They don't have any set up, or they don't even have a requirement that you have to write an essay, but they may have an interview. So the institution has received your application that you want to join the program. So you're given a certain date for interview. When you go to the interview, you may find 2, 3, 4, or 5 members in the panel from the institution, and then they start throwing questions. What do you know about nursing? Do you know what nursing really is all about? If given the chance to join the institution, what are you expecting that you have to go through in this program? Tell us about your high school experience. They're trying to pick your brain to see what is your passion in nursing. What will you bring in once given the chance to join the nursing profession? Is this really your idea, or were you pushed into the program? Is it something that you are forced to do? So they're trying to get to know which candidate really is determined to get into the program, and they want to be able to study and become nurses, and they will get to the end without denying the chance to other qualified candidates. So the interview may be 20 minutes long, 15 minutes long, however long, but the panel is trying to understand their candidate better and know who qualifies and who does not. Then I'll just use this as a final requirement. We have recommendations. Recommendations maybe from the employer, recommendations from your church or religious institution, whether Muslim or Indian. So they want recommendation from your religious institution, church, mosque, temple, wherever. They want a recommendation from your employer if you're currently employed, no matter where you are employed, whether in a healthcare institution as a certified nurse assistant or as a waitress and you've decided to pursue nursing, whoever your employer is, they want a recommendation from there. And then they may want a recommendation from employer, institution of learning, even your previous educational institutions. So by this, I mean you may have to go back to high school and get a referral from there. So when they look at all these recommendations, they'll be able to gauge what are they saying about you? What are your interpersonal skills? How do you relate to people? How serious are you with your academics? And this will come from the recommendation from your educational institution, maybe your high school or the college that you were in before. Then your religious institution, they'll also be able to tell employer, they'll be able to tell what they're saying about you, how your work ethics are. Are you somebody who is serious about your work ethics, So when they put all this together and they compile the information they have received, they'll be able to know what candidate we're allowing into the nursing program that will be serious about their nursing, pursuing their nursing degree. And then they are sure to finish this program and have not denied the chance to another candidate who would have qualified just as well. So I've just given an idea of what the educational institutions may use to qualify you into the nursing program. So they may use one of these criteria or choose to use a combination of 2, 3, even all this. Their high school certificate, how well you performed, looking at your grades, how well you performed in your biology, your chemistry, your mathematics. So they look at the grades there. They may look at use an entrance exam to qualify you. They may use the essay that they may require you to write. They want to know what your thoughts are concerning nursing, or they may even use an interview or referral or recommendations from the various institutions. So that may be the beginning part of this journey into a nursing program. Please understand, it is not into the nursing profession. You have barely even started studying nursing. So this is just to understand whether you can begin this journey. Okay, so once you have qualified, now, some institutions may decide that they want you as a candidate to first do the prerequisite courses. Those are requirements that we have just discussed. Now there are courses that you may have to do maybe for a semester or 2 semesters, that once you qualify, now you will be allowed to join the main nursing program. Remember our Bible story. racing with men versus racing with horses. So this first part, they want to see, can you race with men? Do you have the stamina? Will you keep at it to the finish line? Before you start joining the horses in the nursing program, where now you have longer courses, more intense, more advanced information being sent your way, longer study hours, So they want to be able to understand. And by this, they'll give you now the basic courses. Now, these prerequisite courses, they're prerequisites because they come before the main courses, are about 7. So the first one is mathematics. Now, with mathematics, in these prerequisite courses for a semester or 2, it is not the very intense mathematics that we probably had in high school. I'd call it basic mathematics. So we're not going to see the Pythagoras theorem coming here, but I'll give you an example. The mathematics they're giving you is one that you will apply in caring for patients, for instance, in medication administration. So the doctor has prescribed a medication and said, on this date at this time for this patient, I want you to give 20 milligrams of paracetamol. When you pick up your medication, the label says in every 20 milligrams, you have 2 milliliters. So the medication says 20 milligrams per 2 milliliters. So the physician probably has prescribed, I want you to give 4 milliliters. But the medication says 20 milligrams per 2 milliliters. So it is upon the nurse to calculate and say if 20 milligrams is equal to 2 milliliters, how about 4 milligrams, which the physician wants you to administer to the patient? So 20 milligrams is equals to 2 milliliters. Therefore, 4 milligrams will be 4 milligrams times 2 milliliters over 20. 4 milligrams times 2 milliliters over 20. So you do 4 times 2, 8, divide by 20. And you'll be able to come with how many milliliters this patient is required to get. You're seeing calculations right there. Another example, we have probably a patient who is burnt. Maybe they were going to the stove in the kitchen. When they opened the lid, the steam burnt their face. Now they've been rushed to the healthcare facility. The nurse receives them and wants to be able to give them back fluid. Because when you're burnt, the fluid in your body is also burnt off. It is destroyed. And fluid also refers to your blood. So if you don't have enough fluid and if you don't have enough blood and other fluid in the body, which we'll learn as we go ahead, you may end up dying or even getting into a worse state. So you need fluid to be given to you, but that depends on what percentage of your body has been burnt, and then it will determine how much fluid should be given back to you. So we have something called the Parkland's formula, and so it helps you determine how much fluid is getting to your body, but it requires calculations. So you can imagine the patient has become burnt. You first have to determine what percentage of the body is burnt. If burnt on the face alone, we say that is 4.5%. If burnt until the back of the body and the back of the head, another 4.5%. If burnt on the top part of the chest, that is 9%. If burnt on probably the front part, all these parts have percentage. So you have to go ahead and say, okay, they opened the pot, so the steam has burnt them, maybe the face and the upper chest, until maybe midway on their upper part of their torso. So you'll be able to add 4%, 4.5% plus the 9%, 13.5% burn. That is the calculation you're making. But you need to be able to determine, okay, so how much fluid are we giving to this patient? We go to a formula called Parkland's formula. And it says you give 4 milliliters if it is adults, 3 milliliters if it is children. So let's assume this is an adult who opened the pot. 4.4 milliliters multiply by the weight of this patient. So maybe the patient stood on a scale and they are 75 kilograms. So 4 milliliters times 75 kilograms times the percentage that was burnt. In this case, we have determined 13.5%. So that is our Parkland's formula. Whatever amount you get, for instance, you multiply 4 milliliters times 75 kilograms times, let's say they got burnt here and there on their arm, 20% of burn area, total body surface area that is burnt is 20%. So you may come with approximately 6,000 milliliters. So what this 6,000 milliliters means that is the amount of fluid that you're going to give this patient through the intravenously. Remember the injection that we send straight to the bloodstream? It's called intravenous, inside the vein. So from this calculation, the nurse knows that we need to give 6,000 milliliters of this fluid to this patient who has been burnt 20%. All this, I'm still discussing mathematics. Why mathematics is important. This complicated formula I'm giving has to do with the horses. Remember our Bible scripture. That is what you're going to meet in the nursing courses that you're going to study. So because now you're being given a prerequisite, mathematics prerequisite, it is so that you understand this basic maths, so that by the time you enter the nursing course and you meet this Parkland's formula, where you have to multiply 4 milliliters times 75 kilograms times 20%, you get 6,000 milliliters. And this formula still continues. You have to divide it. You have to know how much you're giving every hour. All this is mathematics. So when you are learning this, you're learning how to use mathematics in calculating your medications, calculating these formulas, getting to, understand all this. Or even when you go to the field as a nurse, you use it in statistics, analyzing data, That is why mathematics is needed as a prerequisite. So you have to pass, study for the 1 or 2 semesters. Once you pass, then they can say you're qualified now to join the nursing program. Sometimes you have already joined the nursing program because maybe you did your high school results are okay, your interview went well, your recommendations were super, your essay was on point. So now once you join the nursing program, the prerequisites may be that first semester or second semester before you can continue. So like I've said, every country, every city, even depending on how the setup is, they each have their own requirements. Some may require 2 of this or 3 of this. Some require the basic requirements to come together with the prerequisites before joining the program. So we have discussed mathematics. Another requirement is English. Not A, B, C, D, and that is it. Not the fact that you can just speak English. Now, the English they're going to teach you is basic English. Composition, how to communicate, the basic part of it. Spelling, very, very important. Spelling, I'll still use paracetamol. Do you know how to spell paracetamol? Because if you do not know the spelling of paracetamol and maybe you replace the first P, paracetamol, and you write paracetamol, those are not one and the same thing. One starts with a P, another one starts with a B. Now, medications, you may find a medication called paracetamol. Paracetamol is one medication. Another brand name may have branded their medication as paracetamol. You do understand that. So the spelling, the English course you're going to go through in the prerequisite is to check on your spellings, to check on your communication, to teach you on that, not just to check. You're able to go through that course, even in your composition, how you write, because you're going to be communicating with other healthcare providers. You're going to be communicating with patients and their families. So you don't want, in case of an emergency, you have picked up the phone and you're calling the doctor saying, oh, the patient is calm, the patient is dying, patient gone. So the doctors and other healthcare providers are not understanding what they're saying. But if you're able to pick up and say, good evening, Dr. So-and-so, this is Ludia, a registered nurse in Unit B2. I'm calling concerning a patient, Mr. XYZ, who came in with it. So you're giving your information. I'm going to take you through this, how we give the information. But you should be able to communicate as a nurse. So that you're being taken into the English course, the basic English, before now you get into the nursing program. Now, there is another English once you've joined the nursing program, a more advanced, where now you will go into all the do's and don'ts of communication, what you can and cannot say, what you can and cannot write down in your notes, how to present information. We're going to look into that. So this is your footman. Remember our scripture once again. This English where you're writing composition, where you're checking out on your spelling, where you're doing the basics, these are your footmen. This is your open field where you're not supposed to be stumbling. Because once you join the nursing program, you meet your horses there. You meet the advanced English, the more deeper communications in nursing that we'll look into as we journey through into the curriculum. Now, that is English for us. Once you've qualified, you move on into the nursing program. The third prerequisite is biology. Now, biology, we have the high school biology, where we learned about the flora and fauna, the plant kingdom, the animal kingdom, taxonomy, Then we learned about the viruses. We learned about parasites. We learned about protozoa. We learned about fungi. We learned about the microscope, how the microscope is built, where the lens is, the slide. All that in biology, we learned in high school. But when you do the prerequisite, you won't so much see the plant kingdom. You'll see the animal kingdom and especially the human body. So the biology that you will learn in your prerequisite, they will try focusing on humans because you are dealing with patients, human beings. So, for instance, like I've mentioned, fungi, bacteria, protozoa, viruses, how it applies to nursing. When you get into the nursing program, you'll start learning things like the skin infection that has been caused by a fungi. When your skin has rashes, the texture is changed, it looks a bit white, that can be a fungal infection. But because in your prerequisite you have learned about, you have gone into a biology course and passed, because in that course you learned about the fungi, you're able to relate with this fungal infection that is now being brought up and the treatments and how to take care of a patient who has a fungal infection. Protozoa. Malaria comes from this protozoa. The Anopheles mosquito has what we call a protozoa called Plasmodium malariae. So once you're in nursing program, the lecturer will not start teaching you about how a protozoa, the makeup of a protozoa, where the mouth is, where the gut is, and what have you. Now they're taking off from where biology left and explaining about malaria and what have you, or how the mosquito bites and then the blood flows through, That is the importance of learning about passing your biology course in the prerequisite. Okay, so we've mentioned we've mentioned the fungi, we've mentioned the protozoa. Then we have bacteria. You've learned bacteria in biology, everything about bacteria, how they look like, how they behave, and everything, where they come from, where Now in nursing, as you join the nursing course, you learn how when it enters the body, what it does in this instance, this other bacteria does this and the other. That is why we even give antibiotics. Antibiotics are antibacterials. They end up destroying the bacteria in one way or the other. So you've learned bacteria in biology. Now you're coming to apply that biology into nursing. That bacteria you learned in biology, now you're applying. It has entered the human body. How do we differentiate that this is not a fungal infection, this is bacteria, and it requires an antibiotic and not an antifungal cream? So that is it. Viruses. We've learned viruses, how they mutate. Now we are applying it. We have human immunodeficiency virus, some sexually transmitted infections are caused by viruses, all that. Biology for you, ladies and gentlemen. Another requirement, prerequisite course, apart from mathematics, biology, and English, is chemistry. Now, other than the high school chemistry, you're doing this prerequisite course for chemistry. It is similar, only with a bit of addition here and there. So you may learn about the periodic table, which you learned in high school for adventure, or just as a refresher course. You have your periodical table. You'll be seeing your calcium, sodium, magnesium, helium, sulfur, oxygen. So you still remember your periodic table, your chemical formula: 1 part magnesium with 1 part sulfur and 4 parts oxygen makes magnesium sulfate. How it is applied, you'll meet it in the nursing course. You've learned this basic chemistry here as your prerequisite. Now coming to the nursing, you'll find it, a medication called magnesium sulfate. You've learned it in the periodic table. You saw magnesium, you saw oxygen, you saw sulfur. You did your chemical formula: magnesium, 1 part magnesium, 1 part sulfur, 4 parts oxygen makes magnesium sulfate. Okay, now I'm into the nursing program. What am I going to meet there? There is a medication called magnesium sulfate. It may come under different names: Epsom salt. Some may call it Mag2. What is it used for in nursing now? Various things. The same salt put in water. If you have a stiff joint pain, it relieves that. It may relieve sprains. It may relieve bruises. Once swallowed, because it comes under different formulations. Some formulation for swallowing relieves, it may give temporary relief for constipation. The same Epsom salt is used in pregnant women. When the blood pressure is getting high, we call that preeclampsia. The pregnant women are given magnesium sulfate. And then in eclampsia, or even to prevent getting to eclampsia, you're given the magnesium sulfate to prevent that pregnant woman from convulsing. So you have to learn the chemistry so that when you come into nursing, you are able to relate the two. All right. Another prerequisite is psychology. So you'll get psychology as a course, a basic prerequisite, where you're taught about the mental, how humans, you're dealing with human beings, how human beings, how their mental makeup is, their emotional makeup. You're learning the normal in psychology. So that when you come to nursing and you start meeting dementia, you meet schizophrenia, you get bipolar disorder, all these psychiatric mental health issues, this is not normal. You are able to relate that this is normal versus this. So when you see a child all up and about, you won't call it bipolar disorder type 2, maybe manic disorder, because that is a child. You've learned psychology, and you know that for children from this age to this age, this is normal for them. But when they get from this age, maybe 20 years and above, this is a young adult. So this is out of the norm, because in psychology, adults are supposed to behave this way. But this one, in this case, this is a disorder, and so you are able to manage them in hospital. Yes, you may not be doing the medical diagnosis, but in caring for them, you care for them knowing you're caring for an autistic child. So yes, it's not normal. They are 13 years old. They should not be behaving this way, because a normal person, according to the psychology we learned, is this and the other. Now, in basic psychology, you're being taught in your prerequisite course, you're being taught more about the normal for each age group, and just understanding what psychology is all about, how to, when you're going into a social setup, you know what to expect there. So that when you come into nursing and you meet a patient, you know what is normal and what is abnormal, and how to take care of this person, because this is not the normal, but they are under care, they are under treatment. So we've mentioned mathematics, we've mentioned English, we've mentioned chemistry, we've mentioned biology and psychology. One other course that we may include in our prerequisite, I think I'll pause there. Anatomy and physiology. However, anatomy and physiology, sometimes you find it in the main course, but some institutions use it as a prerequisite. Once again, anatomy and physiology, which is really the structure and the function of the various parts of the body, it may be taught as a basic prerequisite, or once you join the nursing program, you will get it there as anatomy and physiology 1, 2, or 3. So it depends on which side, but you must get anatomy and physiology course. Now, the anatomy and physiology, you're learning it in basic as a prerequisite course, because you're going to learn about the various parts of the body, from the crown to the sole of the foot. So it is in anatomy and physiology that you're going to dissect this body in various parts. You'll go through the bones. What is the makeup of the bone? From the external part to the very core part of it, what is it made up of? How do they connect with each other? What is the function of these bones? The same thing with maybe the eye, one eye. What is in the structure of the eye from the outside? All the different parts you see in the eye, the white part, the black part, this is called cornea. This is the pupil. This is the iris. Or we have the optic nerve. Or we have this layer. Or inside we have the cones and the rods. What is their function? All that is what you learn in anatomy and physiology. So as a prerequisite, the candidate may have to know all this, because once they enter into the nursing program, or as they progress into the nursing program, if it was not a prerequisite, they'll go deeper and deeper. Now they'll be learning about the blood and these cells in the blood. And some of these cells are produced produced from the bone marrow. So it is not for the student to ask, now where is this bone marrow? Because as a prerequisite, you learned in anatomy and physiology that the bone is made of the outer part, the next layer, all the way to the bone marrow. So the moment you start learning about the red blood cells, the platelets that they are produced from the bone marrow, your mind immediately goes to that bone that you learned in anatomy and physiology, and you know where the bone marrow is and how it will flow through into the bloodstream. So, ladies and gentlemen, those are our prerequisites for today. Like I've said, some institutions may combine this and even more, others even less, but more than likely you'll find all these prerequisite courses once you qualify. Before qualifying into the nursing program, you must have gone through these courses, understood them, done your examinations, and once you meet the cutoff point, then you join the nursing program to now start learning matters nursing. That is it for nursing prerequisites. Another part that I want to look into Or probably I'd add one more prerequisite, but this is maybe or maybe not. And that is nutrition, because sometimes nutrition is found as a prerequisite, but most of the time it is found within the nursing program. So I'll just throw it in there that as a prerequisite, you learn about the carbohydrates, what foods are in the carbohydrates, your bread, your rice, your oats, your rye, your barleys, your wheat. Those are carbohydrates. Then your proteins, you have your meat, meat family. Milk also belongs to the protein class, So you may look into that, which foods are in which category. Your carbohydrates, your proteins, your vitamins. We have vitamin B1, vitamin A in carrots, vitamin C from oranges. So you're able to understand these food groups, because once you start nursing and you look at a patient and they have scurvy, that scurvy, that it is deficiency of vitamin C. So it is not because the nursing courses are intense and they are also fast-paced. So once you hear scurvy caused by vitamin C, in your prerequisite, you've already learned about vitamin C, what foods are required for your patient now. So immediately you learn that it is a deficiency of vitamin C. You know that this patient, I should serve them oranges or citrus foods, because they will be able to get the vitamin C that they are lacking. So, like I said, nutrition, you may get it as a prerequisite course, but sometimes once you join the nursing course, these are among the very first. The anatomy, physiology, and the nutrition, you may find it as among the very first courses before progressing with other courses. So they make up among the foundational courses. So I'll stop there. As the prerequisite courses. We have seen the requirements for even being considered into the nursing program, our high school diploma, our interviews, our basic entrance exams, the essays that the student may have to do, or even the recommendations. We've also seen now the prerequisite courses, our mathematics, our English, chemistry, biology, psychology, and then I have touched on nutrition also, and anatomy and physiology. So now, this candidate has passed. What next? Now, once they have passed, the educational institution may send you a congratulatory letter and welcome you to the nursing program, say you have qualified, because probably they had 200 or 300 students or candidates who wanted to join their institution and study nursing as a diploma, as a degree, as a whatever. So now that they have shortlisted, they've gone through these 300 candidates, taken them through these requirements, basic requirements and prerequisite courses. They are able now to use that to determine who gets in and who may have to try again later. So this is the first batch coming in. So once they have to come in, they are given some requirements. Some of those requirements may include maybe they need to go for their medicals to see if they are medically fit. So they may have to go ahead and go to a physician, maybe designated by the institution, or they can choose their own physician who will write a report about their physical makeup. So by then the physician is able to do a physical exam. The usual that we do in doctor's office, comprehensive, the vision. How is your vision? Is it 20/20? Or this candidate requires glasses, or you're wearing glasses? This medical exam will not necessarily disqualify the candidate, unless, of course, it will hinder you from going through with the nursing course. For instance, when the physician checked you and did a comprehensive exam, you cannot bend, you cannot lift something maybe 10 pounds, 10 pounds heavy. You cannot turn because there's pain that is debilitating. So those are the kind of things that may disqualify until remedied, meaning maybe you get treatment for it, or you get medication for it, and will allow you to do this, because once you get into the nursing program, you must have to be able to bend, to stretch, to turn, to lift, to pull, to push. All these body mechanics may be necessary in the nursing program. So here you have to be able to pass your medical examination. Some urine tests may have to be done to check for pregnancy, because maybe they want to determine how far off are you. Again, a pregnancy will not disqualify you. Students have come to class while pregnant because they may be married students. Or you may be too far gone, and they may tell you, first go and have your baby, go through maternity leave, then come and join the program. Because remember, I've told you, it is an intense program. You have to sit down in class for so many hours. You have clinical rotations that will require you bending. How will you bend with when you're so heavy? It may be so taxing. So by this, you may end up denying a student who could have entered into the program and done well and gone through, while you may have to go for 3 semesters, then you have to 2 semesters, then you have to pause for maternity leave, while another student could have gone through. So you're being told, go home, get your baby, do maternity leave, then come and join the program. So medical exam again may involve getting vaccinations like hepatitis B, because this one can be transmitted from blood or body fluids into your body, or from yourself into the patient. So you get vaccinated with the hepatitis B, or even influenza, because once you have a flu, you can pass it to the patient. So to protect yourself and also to protect the patient, there are some vaccinations that you may have to get as a prerequisite. The pregnancy test, some, depending on the institution, whatever it is that they may require to have checked, including the comprehensive examination from the physician. Then other than that, as a prerequisite, some institutions may or not require basic life support certificate or CPR certificate, where you go through a course. Sometimes it's 1 day long or 2 days long, but a few hours, where you're taught how to resuscitate a patient. So some institutions may require you to do it before now joining the nursing program, but others may require that once you're in the program, you're taught basic life support and you get your certificate. So by the time you're joining as a profession, you have your first basic life support certificate. All right, so a background check, very important. This has become more common in the recent past, that the educational institutions require that before you join the nursing program, you get a background check. Why? This police check or background check will determine whether you have a criminal record or not, whether you're a safe nurse or not. Because even as a student, you'll be doing clinical rotations. So who wants a nurse who has a criminal record, maybe for murder, or violence, or mental instability, and then you come in as a nursing student? It is dangerous to the patients you will be working with in your clinicals, or even once you graduate as a nurse. It can be very unsafe. So to ensure safety of the patients and even on yourself, because if you have a criminal record, maybe for drug abuse, although that is another check also, then you're at risk to yourself and the patients. You're going to be handling so many drugs. And so they don't want you to be tempted and then harm yourself, or even tempted, deny the patient their medication as you are taking the drugs. Or even using, because you're not in a perfect frame of mind, you are harming the patient by overdosing them. So, number one, they may require basic life support certificate. Number two, they may require the medical examination. Number three, it is a background check or a police check. Then number 4, like I've just mentioned, is your drug screening. So they check your urine and your blood. They do an examination on you to find out, do you have any drugs in your system? Are you under any influence of any drugs that can incapacitate you while taking care or while performing your duties as a nurse, or even going through the nursing program? Even going through the nursing program, when you're on drugs, it may be difficult sitting through a 5-hour lecture. It may be difficult even reporting to duty during your clinicals. It may be difficult, coordinating yourself during clinicals. You're at risk to yourself. You're at risk to your colleagues. You're at risk to the patient. So these are the requirements needed. Ladies and gentlemen, I will finish off at this point. I have taken you through the requirements, both the basic requirements for joining a nursing course. I have taken you through the prerequisite courses and other requirements of like the police background check, the medical examination, etc. I have combined all this for you who is interested in joining a nursing program, to know how you can prepare yourself mentally, to know, yes, I want to join this program. I know I will finish because now I have the stamina. You've counted the cost, you have heard me, you've understood what I have said. You as an individual know, yes, I do want to join this program because I can handle all this. You who is planning to start a family, you've understood, go ahead and have your children, or go ahead and pace yourself and know at this point, I can join from this point, because this, to other institutions, pregnancy may disqualify me and allow me to first have my baby because I'm far gone, or it may not matter depending on the institution. I know I can have the baby, but I should be prepared to break for a semester or two to nurse the baby before I continue. Or I know that I cannot handle it because pregnancy comes with all this psychological, mental instability here and there. And so I may not be able to withstand an added stress to the body through the nursing course. So let me take care of my baby once the baby is 1 or 2 years old, then I can join the nursing program. Even you, the parent or guardian, you've understood what I have said. In this case, you're able to guide your child, talk to them, explain what it entails, so that they can also participate in making the decision that nursing is for them, or it is not, and giving them another direction that they can take in order to pursue the career of choice. So, having said all this, in our next episode, we will jump into the nursing program. We have passed our basic prerequisites. We have passed our other requirements, the medical examination and immunizations. We have everything that this institution requires to start the nursing program. Now, once we have joined the nursing program, what are we learning? What are the courses that the nursing program entails? How are they? How do we scale through? I'm going to take you through the entire nursing program. And I will also open up and share with you the scriptures in the book of Proverbs that helped me through all my nursing school journey. I had 2 major scriptures that I held on to day and night through anything that looked impossible, until I finished my nursing program. I don't know how that happened. I was reading my Bible, I was flipping through other books, but I meditated on 2 major scriptures, and it helped me through from one course to the other until I graduated. So join me in my next episode. I'm going to share that with you. You may ask, so what was your secret in this passing your prerequisites? Well, I'd say because I had done them in high school, it wasn't so much of a challenge in high school, apart from chemistry, but I understood that I could not run away from this chemistry. It was a passion to join the nursing program. So I just had to focus on whatever I had learned before in high school, just putting a little more effort into passing whatever I was learning as a prerequisite and join the nursing program. What I'm grateful for is that once I joined the program, we were no longer doing chemical formulas. We were no longer going so deep into chemistry, which was a challenge for me while in high school. So I appreciate that biology was much easier for me. I enjoyed it. It was a walkover for me. But the chemistry that I had really struggled with in high school, I knew that I have to do it here. We had been told we are meeting it again. So I had no way of evading it. So I took it one day at a time, whatever came through, and was so grateful that I never saw some of the things that I had seen in high school, but it was more about the just understanding what do you call it? For instance, like the way I've mentioned magnesium sulfate, understanding that it is made of a chemical compound based on magnesium, sulfur, and oxygen, and then what it does, and then like sulfuric acid, you know how volatile it can be. So those basic chemistry that I took in, I tried to apply during my nursing program is what I had focused on during my prerequisite. So I didn't see much of a challenge because I was determined, let me just give it my all because I have to meet it again. So getting to the nursing program, I'm not seeing some of those things. I was grateful, scaled through to the end. So ladies and gentlemen, once again, join me. Oh, you may ask, so how are we applying all this in our daily life? Because nursing is a ministry. Well, I've mentioned biology. Pardon me. So you may ask, how do we use whatever we have learned today to apply in our own lives and become those nurses? I have just stated that as a parent, you can guide your child on what the prerequisite is all about before they join the nursing program. Talk to them about the essays, what they can expect, that they are going to state it is their passion. If your child says no, but it isn't, then you know that this is not a child to push into the nursing program. Talk to your siblings, the younger ones, and explain to them what you have learned. Then you are able to bring all this information, tell them what is expected of them, tell them about the chemistry. Maybe they're still in the third year in high school and you're looking to encourage them towards nursing. So by the time they're finishing their fourth year, they already know that in this examination, I need to really do my best because they may have to look at this high school diploma to qualify me into the nursing program, which is where I am headed to. So use this information. Nursing is a ministry. Take all that I have taught you, all the requirements that are needed, share it with your family members, share it with your relatives, share it with your neighbors, and then you're helping another person be able to make an informed decision based on nursing. I believe I have done my best in sharing all this information with you. If you have any question, let me know in the comment section. Other than that, join me in my next episode as we delve into the nursing program and as I now share with you the courses that are involved in the nursing program from beginning to the very end. Until then, have a beautiful day. This is Ludia Osita once again. Goodbye.